In this video, you will see the novel mechanism of action for first-in-class Rukobia, the first Food and Drug Administration or FDA-approved attachment inhibitor for HIV-1. Indication: Rukobia, used with other antiretrovirals, is indicated for heavily treatment-experienced adults with multi-drug-resistant HIV-1 who are failing their current ARV regimen. Important safety information. Contraindications: do not use in patients with previous hypersensitivity to fostemsavir or any of the components of Rukobia. Do not use Rukobia in patients receiving strong cytochrome P450 CYP3A inducers, including those listed here. Please see additional important safety information for Rukobia at the end of the video. Please click the link on this page to view the full prescribing information for Rukobia. The outer GP120 protein mediates initial attachment to the CD4 T cell. The GP120-GP41 trimer dynamically transitions between open and closed states. When in the open state, the GP120-GP41 trimer is able to bind to the CD4 T cell. The three main steps of viral entry are GP120-CD4 attachment, co-receptor binding, and membrane fusion. Attachment occurs when the GP120-GP41 trimer is in the open state and binds to the CD4 receptor, causing a series of structural changes in the GP120-GP41 trimer. This allows the subsequent binding of GP120 to a cellular surface co-receptor, either CCR5 or CXCR4. This sequential binding allows for further rearrangements in the glycoprotein complex, which drives the fusion of viral and cellular membranes. Three antiretrovirals that block entry act following the attachment of the GP120 viral envelope protein with the CD4 target. In comparison, blocking the attachment of GP120 prevents the earliest stage of HIV-1 and CD4 T cell engagement. A first-in-class treatment with a novel mechanism of action, Rukobia is the first FDA-approved HIV-1 attachment inhibitor. Rukobia prevents HIV-1 from interacting with host immune cells, leaving CD4 T cells untouched. Temsavir, the active moiety of fostemsavir, binds to the viral envelope protein GP120 to prevent initial HIV-1 attachment to CD4 T cells, the first step of HIV attachment and infection. Temsavir attaches directly to GP120 and selectively inhibits the interaction between the virus and cellular CD4 receptors, thereby preventing attachment and all post-attachment processes. The activity of temsavir was not affected by viral strain or tropism. The attachment of temsavir locks the GP120-GP41 trimer in a closed state to prevent binding to CD4 receptors. With the HIV-1 virions unable to attach to CD4 T cells, they are a target for elimination by the body's immune response. Additionally, with the novel mechanism of action of Rukobia, there is no observed cross-resistance between Rukobia and currently approved ARVs, including ARV classes that block entry for HIV-1. Important safety information continued. Warnings and precautions. Immune reconstitution syndrome and autoimmune disorders have been reported with the use of Rukobia. QTc prolongation has occurred with higher than recommended dosages of Rukobia. Use Rukobia with caution in patients with a history of QTc interval prolongation or cardiac disease, or who are taking drugs with a known risk of torsade de pointes. Elderly patients may be more susceptible. Monitoring of liver chemistries is recommended in patients with hepatitis B and/or C co-infection. Diligence should be applied when starting Rukobia in patients receiving hepatitis B therapy. Adverse reactions or loss of virologic response due to drug interactions may occur when using Rukobia with other drugs. Adverse reactions. The most common adverse reaction reported with Rukobia was nausea. Drug interactions. See the full prescribing information for Rukobia for all significant drug interactions. Temsavir may increase plasma concentrations of grazoprevir and voxiloprevir. Use an alternative hepatitis C virus regimen if possible. Use the lowest possible starting dose for statins with careful monitoring. Patients receiving Rukobia should not take estrogen-based therapies that contain more than 30 micrograms per day of ethinyl estradiol. Use Rukobia with caution in patients with additional risk factors for thromboembolic events. Use in specific populations. There are insufficient data on the use of Rukobia during pregnancy to assess drug-associated risks. Breastfeeding is not recommended in patients with HIV-1. Please use the link on this page to view the full prescribing information for Rukobia.